8:11 now, Thursday morning. Every now and then we check in with Dr. B, our good friend, Dr. Brent Wallis, Chief Medical Officer of People's Health. How you doing, Dr. B?
Hey, Tommy, I'm doing great. How about you?
Good. How are those boxers?
Doing okay. Crazy as usual.
Have you ever wondered, and I was saying this earlier before we get to the serious subject matter here, and I was looking at the dog yesterday, just completely tearing a $20 toy apart and then stopping and looking around. I'm just wondering, what is going on in there? What are you thinking about? Are you thinking...
I don't think they're thinking very much.
Are you thinking, well, let me get back to destroying this. You can go back and buy some more stuff. Oh, what was that?
I know. I do sometimes wonder if I should just throw a 20 on the floor because they go through them pretty quickly.
That's what I was thinking. I'm thinking, would you rather the money, maybe? Well, good health isn't just about how you feel physically. Your mental well-being is important, too. Your mental well-being is important, too. But it's not always easy to share your feelings and ask for help. That's why Dr. B is here from People's Health to talk about your mental health and why it's so important to have open conversations with your doctors. And Dr. B, I guess we'll start with, what is mental health?
Yeah, sure. So, mental health is actually pretty simple. It's really just, it's everything that includes your emotions, your psyche, or how you feel psychologically, and your social well-being. And mental health really affects everything in your life. It affects how you feel, how you think, and even sometimes how we act, to ourselves and to others. And it's a major part of your overall health because research has shown over and over that if you take care of your mental health, you're actually going to improve your physical health as well, and it works in both ways.
It seems like when you say mental health, sometimes it can be pejorative or people can look at that negatively when, in fact, everybody has mental health. It's either good or it's not good. Let's talk about mental health conditions. What is a mental health condition?
Yeah, so there's a whole host of mental health conditions, and these are, medical conditions that really affect a person's emotions, maybe how they think, and in particular, they can affect how they behave. And so some of the most common that we see, all the time are things like anxiety disorders, depression, and then post-traumatic stress disorder, or PTSD. So those should all be familiar to people.
Let's start with anxiety disorders. What is that?
Yeah, so it's really common, and everybody feels anxious at times. If you're in a difficult situation, maybe you're going to a job interview or you're speaking in front of a crowd, it's really very common to feel anxiety, and that can be healthy anxiety because it helps you stay alert, maybe helps you stay motivated and get done what needs to be done. But when you have an anxiety disorder, it's something different. It's actually feelings of fear and distress that can become overwhelming and ultimately make it hard to actually do everyday tasks. And there's different types of anxiety disorders. Each one has different symptoms and probably different sources that trigger it. But in general, people that have that condition have that constant feeling of fear or nervousness or maybe even dread accompanied by physical symptoms. So people can actually have shortness of breath or even a racing heart, and some people even will develop stomach aches.
What is depression, Doc? How do you define that?
Yeah, so, depression can actually be very normal. It's normal to feel sad, but clinical depression is actually different than just feeling blue. It can be a very serious mental health condition because people who have true depression, clinical depression, typically will feel sad and anxious or maybe not have any feelings at all, and they have this for a long period of time. They no longer enjoy their hobbies, and then they can have effects on their sleep as well. So they may sleep too much, or they may have insomnia and not be able to sleep at all. And then it definitely can affect other things like eating. Some people will overeat when they're depressed. Some people will not eat at all. And like I said, these are really long-lasting. These are not short episodes of depression. They really can make it difficult for you to do anything in life like work or be social or sometimes even take care of yourself or others.
So we've talked about anxiety disorder and depression. What is PTSD?
Yeah, so post-traumatic stress disorder, or PTSD, really happens when you've had a truly traumatic event that has lasting effects on your mental health. And so we see a lot of these, in particular, people who have experienced military combat, for example, or an assault, or maybe a severe accident. they can actually develop PTSD where they have flashbacks to that event, and that may cause trouble with them sleeping. It may actually cause them to have these outbursts of anger, and then as well as that, long-lasting feelings of sadness or sometimes even guilt, depending on what the trigger is.
So if any of this is resonating with people, what should they do, or what should people do if they have symptoms of a mental health condition?
Yeah, so, a lot of people may not realize this, but the first thing you should do is schedule an appointment with your primary care provider, and you should do that right away. And a lot of people say, why primary care? Why not try to go to a mental health specialist? But primary care physicians actually diagnose well over half of all these mental health conditions, and they're not going to go away without treatment in a lot of cases, and often they can actually get worse over time. If you do feel like you're having a really immediate need, if you feel like you need immediate treatment, which does happen, in particular, if you may have feelings about harming yourself or maybe harming others, that's where you need to go to the nearest emergency department, because those situations have to be taken care of right away.
So let's go down, drill down a little bit more on how your primary care provider can help you with your mental health.
Yeah, so primary care can actually do a lot of things for you. Mental health concerns are one of the most common things we see on a daily basis. And, what we can do is we can help you talk through those issues, kind of understand what your symptoms are, and then really kind of nail down a diagnosis and provide some tools to you to help manage all of those symptoms that you're having. And those tools can be multiple. We may use different things like therapy is very important. Medications play a role in this as well. And then maybe lifestyle changes to really support your healthy mind. And the big thing you want to remember is you've got to keep your primary care provider up to date on really all your care. That includes medical care, but it also includes any mental health care that you may be getting. So if you do go see a therapist or a psychiatrist or any sort of mental health provider, you want to let your primary care physician know about it. And in particular, if you've been to the emergency department for a mental health concern or really any concern, you want to let your primary care doctor know about that as well, because they really need a full picture of what's going on with you.
So that's why it's important that you share that with them. And again, it's all covered under privilege, right? Under doctor-patient?
Yeah, absolutely. All of this is confidential, but it's extremely important. You get the best care from your primary care doctor when they've got that full picture of what's going on with you. Your provider is going to monitor your symptoms, understand how you feel. They may need to make changes to your treatment depending on how you're doing with what you've been provided. But it's really important to let your primary care provider know, in particular, if you've been prescribed a new medication, for example, you want to make sure that that new medication doesn't interact with anything you're taking. Other medications for things like diabetes and high blood pressure, but even some of those supplements people take, vitamins and other things that could interact with this new medication you may have put on.
Let me take a break. We're talking to Dr. Brent Wallis, Chief Medical Officer of People's Health. Good health isn't just about how you feel physically. Your mental well-being is very important, too. That's what we're talking about with Dr. B. We'll come back. We'll talk about, what do you tell somebody who's nervous about getting mental health care? 820 Traffic Now, WWL. 825, Tommy Tucker, WWL, back with Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, talking about mental health and how good health isn't just about how you feel physically, but your mental well-being is important as well. So, Dr. B, before we went to the break, we talked about, what would you tell somebody who's nervous about getting mental health care?
Yeah, a lot of people are nervous having these discussions, maybe even with a family member, but certainly with their physician as well. And actually, men in particular are less likely to have this conversation with anyone. So, what I would say is, don't let that mental health stigma stop you from getting care. Deciding to get treatment for something that is affecting you, especially something as serious as this, or if it's even a physical problem, it's really a sign of strength to go and try to get help. It means you're taking charge of your overall well-being so that you can be there, for yourself and for your loved ones. And then the other kind of key thing to remember is you're not alone in this at all. Mental health conditions are very common. In fact, 1 in 5 adults in America, so that's about 55 million people, has had a mental health condition at some point in their life. And your primary care provider has definitely worked with a lot of patients who have some of these concerns about their mental health. They've got a lot of resources that can help you, so they are the person you want to talk to about this.
I think it's interesting. It's kind of like the thing in the plane where you put the oxygen mask on yourself before you can help anybody else, right?
Yeah, absolutely. I mean, if you're in a condition where you can't do what you need to do for yourself, you're not going to be able to help your loved ones at all either.
So do you have some tips for like how to talk to a healthcare provider about mental health?
Yeah. Because this can be kind of a difficult conversation, there's a couple of things that I tell people to do to make sure that you're kind of prepared to have this discussion. And one of the most important is, make some notes for yourself. It can be difficult once you get in the room to kind of start this conversation. So write down what you want to tell your provider and, even read those notes, at your visit. We're not going to be upset about that at all. We want to know what's going on with you. And then another thing that a lot of people have probably noticed is when you do all that pre-visit paperwork that we ask you to do, a lot of times some of those forms may have some screening questions in them. We use some screening devices that actually ask questions about your emotions and what your outlook is about things, and those can actually give us an indication of whether we need to initiate a discussion with you. And when we do, please be honest about it. We can't help you if we don't have the full picture. We want to have that discussion about your mental health during the visit, and maybe that'll remove a little bit of the pressure to start that conversation yourself. And then again, just to emphasize, having that open conversation both about your physical and your mental health is really important. We want to help you. We want to make you feel better. And so I can't emphasize enough about being honest about what your feelings are.
Somebody texted in, doctor, about their primary care provider, been seeing them for 30 years. They feel as though they may have some issues and they don't want to be viewed in a negative light by their primary care physician. How would you address that? What would you tell them?
Yeah, I would not worry about that at all. I mean, we do develop relationships with our patients, and we want to do what is best for them. So, so feel free to have those discussions with us. We, primary care physicians really want to have those conversations with you because, again, if we can get your mental health, fixed, then we can actually improve your physical health as well, and that's really what we're here to do. So free conversation is absolutely necessary.
And I would think, if you've been treating somebody for a long time, just like, when you go to the doctor and you got poison ivy and they ask you, have you been around poison ivy? No? Really? That's interesting because you have it. Chances are you can tell something's wrong with the patient before they bring it up, right?
Yeah, and that's one reason why you should make sure you're establishing a relationship with a PCP. It's important because over time they will be able to identify both those physical issues, but they can also tell if you're coming in and you seem a little bit down or something's off, they're probably going to initiate that conversation with you and ask you what's going on, and that's where you really want to make sure that you're honest and you tell them exactly what's happening because they may be the first ones to actually bring it up to you.
Thank you, Doc. Very valuable information. Dr. Brent Wallis, Chief Medical Officer of People's Health. You can find out more about People's Health plans by visiting People's Health Medicare Center. It's in Metairie, 3017 Vets between North Causeway and Trader Joe's. Appointments are recommended, but walk-ins are welcome. You can always go to peopleshealth.com or you can call them at 1-800-978-9765. We'll talk with Eric Skrmetter, Public Service Commissioner, about MISO and the Memorial Day brownout and more when we come back. Right now, time for WWL First News.